Alex, you remember last time we went to the hospital and we sat there all day and nothing happened last June?
Yeah, Dad.
It's a good thing it'll never happen again, right?
Right.
Okay.
Meet Alex Tennyson. He's an Oregon adult with autism. He works in a recycling center, has brilliant memorization skills, and he loves video games. But his dad Larry knows there's more. Alex has a history of mental health challenges. KGW first talked with the Tennysons about them a year ago.
He hears train whistles from when he's a kid. What do you think? What do you think when that happens?
That makes me scared.
Yeah.
And when the incessant noises start, Alex has flipped a switch.
How'd you get that knot up there?
Because.
You hit your head to try and make it stop?
Yes.
Doctors previously told the Tennysons that people like Alex don't make good patients for mental health care.
And that's what we ran into before, is we kind of got nothing. We kind of got sent it off. So now I don't think that's going to be an issue, hopefully.
This session, Oregon lawmakers unanimously passed a bill that says people with intellectual or developmental disabilities cannot be denied access to mental health assessment, treatment, or services.
It's not appropriate for a person having a psychotic break to walk into an emergency room and be told, we don't do people with intellectual and developmental disabilities. And that happens. It's happened to a family member of mine. It's happened to many, many people.
Senator Sarah Gelser-Bluin and the bill's other sponsors said legal loopholes allowed public agencies to deny services, and people with disabilities faced gaps in care and fragmented services for too long. Governor Kotek signed that bill into law.
For us and, Alex and myself, it means we can have confidence we go into an emergency situation or a place where we get medical care. We don't have to explain anything about IDD or DD or autism. Theoretically, we can just say, those are his issues, but expect to get the same type of treatment we would if he didn't have those issues.
Larry Tennyson calls it a win for the community. Thankfully, Alex hasn't had as many issues in the last year following a change in support companies and medicines. The calloused knot on his forehead, hopefully a sign of the past.
And Alex, you're having a good day?
Yes, Evan.
A good day.
I'm having a good day.
The Oregon Health Authority will likely send out a memo to healthcare organizations and hospitals around the state explaining the new requirements and how providers should be trained. There's no outline for penalties if hospitals or providers don't comply, but people like Larry and Alex say they now have this bill that at least they can point to. Back to you.
Yeah, it certainly says a lot that support by lawmakers was unanimous. Thanks, Evan. Appreciate the follow-up there.